Hello and welcome to our next installment of our next webinar. This is webinar number 2. And before I get started today, I have to go through the traditional disclaimer. The information in this workshop is not intended nor should it be used as a substitute for standard medical diagnostic methods. Any recommendations are the opinion of Global Health Solutions, and the clinical judgment must be adhered to based on the healthcare provider's scope of practice. HeartQuest and VitalScan are heart rate variability tools currently developed for research and education. Some of the analysis on the HeartQuest and VitalScan are derived from indices of commonality between the frequency domain and its relationship to traditional HRV, Chinese, and Ayurvedic medicine. The standard HRV values can be used to validate the effects of other modalities and lifestyle changes. The rest of the parameters come out of scientific research from Soviet scientists and Global Health Solutions observations and innovations. Currently, neither the HeartQuest or VitalScan are FDA compliant. Now that we got that out of the way, I always like to talk about my friend Charles Darwin here, because I love this statement that he says because it really applies to the HeartQuest. It's not the strongest of the species that survive, nor the most intelligent, but rather the one most adaptable to change. And that's kind of what we're looking at when we look at the HeartQuest, the patient's ability to adapt to all stressors. So to improve the quality of our patient's health, we need them to have flexibility or plasticity in the central nervous system. They also need to have an autonomic nervous system that can respond instantly. It is not rigid or stuck in one branch or another. Most important is the biodiversity in the gut microbiome. I talk about the microbiome, and these little guys in here, these little bacteria in here, communicate, which we're going to talk about today, via the vagus nerve to the brain. That's why it's highly involved in mood. And the communication between the gut bacteria, the vagus nerve, and the brain is very, very important. We need to make sure that that patient not only has a healthy gut microflora, but also has a good functioning vagal tone, or that's part of the parasympathetic nervous system we're going to talk about today. To accomplish this goal, we have to understand the cholinergic anti-inflammatory pathway. We're going to really spend some time with that, and the vagus nerve and how to increase its tone. So we've got some exciting new information for you. The rest on this sheet here, on this slide, we're going to cover on a later webinar. Because the need to remove reactive foods and pathogens, the importance of healing the gut, how to reestablish a healthy, balanced immune system, and how to improve the gut microbiome with specific flora, because we're all trying to improve the quality of our patient's health, and we want to see those changes reflect on the HeartQuest, and we need to cover all those particular ways of improving our patient's health. Now, here we're back with the vagus nerve, and here's Superman, and he certainly doesn't look very well. He says, I used to feel great, and now my vagal tone is almost non-existent. And you look down here at the HeartQuest, and we look at this little sliver at 4% HF, which is the parasympathetic nervous system, and the main nerve, or part of that parasympathetic nervous system, is the wandering nerve, the vagal nerve. And we're going to see today about all the different implications. And you can see here from the literature that with low vagal tone, there's all these things like obesity and weight gain and IBS and depression and anxiety, chronic fatigue, high and low heart rate, difficulty swallowing, heartburn, dizziness, and fainting. B12 deficiency, which you're probably wondering, well, how does B12 deficiency tie into that? Well, we'll talk about that, and chronic inflammation, which we're going to hit hard on. So here it is. What is the big deal about the vagus nerve? Remember, we said it's the wandering nerve. Most of you know that. And the vagus nerve reaches the brain, the gut, heart, liver, gallbladder, kidney, ureters, spleen, lungs, fertility organs in females, the neck, which includes the pharynx, the larynx, and esophagus, ears, and tongue. I mean, it covers a lot of ground, right? And when we lose tone, as seen on HRV, and it's not working as it should, the patient can have digestive disorders, including dyspepsia, gastroparesis, esophageal reflux, ulcerative colitis, and IBS. Because, when we all know that the parasympathetic is highly involved in digestive function, right? And people with impaired vagus nerve can suffer with depression, panic disorders, anxiety, and mood swings and chronic fatigue. I think that's a whole subject that we'll cover in another module, how the vagus nerve ties in to the brain, communicating information from the gut. And we'll talk about that. So here we have it. Here we have, Wimpy. I don't know how many of you watched Popeye. I'm kind of aging myself. But there was this guy named Wimpy, and he just loved hamburgers. Couldn't wait to con you out of a hamburger. He says, I will gladly pay you Tuesday for a hamburger today. And he just looks at that thing, and his juices are flowing. The sight, the smell, the taste, that sensory information goes to the hypothalamus. And the hypothalamus stimulates the medulla. The medulla is going to stimulate the vagus nerve. The vagus nerve stimulates gastric secretions via the parietal cells. And most of you know about the parietal cells. It produces HCl, hydrochloric acid, to break down our protein. It is also highly involved in, we need that acid environment in the stomach to kill off bacteria and viruses and parasites. And it's also very important for that intrinsic factor to work. We have to have the right pH in there for intrinsic factor, that acidic environment, for this to work so we can absorb our B12, which is needed for our nervous system. It's really hugely important in methylation, which is a whole subject in itself. And methylation, we know, is important in hundreds of biochemical reactions. One of the big ones is methylation is important so we don't express genes that we don't want to express, and repairing our genes and all those good things, right? Here we go. The vagus nerve maintains general kidney function. It helps with glucose control. The vagus nerve also increases blood flow, which improves blood filtration. So, anytime you're detoxing any of your patients, I like to use to improve the blood filtration by increasing the circulation through using kidney drainage remedies, right? A lot of us use that. We're on this call today. And the vagus activation also releases dopamine in the kidneys, which helps excrete sodium and thereby lowering blood pressure. And you can kind of see why, dopamine in the HeartQuest is kind of related. We figured that out to the water element in Chinese medicine, and it's tied into the kidneys. Vagus nerve supply to the bladder. Less vagal stimulation can cause the patient to urinate more frequently because the vagus nerve is involved in urinary retention. Here's the big one. This is the big one we're going to be talking about now. The vagus nerve will reduce inflammation in all target organs by releasing acetylcholine. But when it activates in the spleen, the response is more systemic. So we're going to be talking again, get this cholinergic anti-inflammatory pathway mediated by the vagus nerve, and we're going to teach you how to stimulate that. So here's one of the most prestigious journals, Nature. And it's talking about this nicotinic acetylcholine receptor alpha 7 subunit is an essential regulator of inflammation. And we're going to talk about how that occurs, but excess inflammation and tumor necrosis factor, kind of the bad guy that we find in all the autoimmune diseases that create all this destruction and inflammation. So this tumor necrosis synthesis causes morbidity and mortality in diverse human diseases, including endotoxemia, which we'll talk about, and that's usually gram-negative bacteria leaving its coat in the blood and our immune system reacting to that, causing all these inflammatory reactions. Sepsis, rheumatoid arthritis, and inflammatory bowel disease. So highly conserved, endogenous mechanisms normally regulate the magnitude of innate immune responses and prevent excessive inflammation. The nervous system through the vagus nerve can inhibit significantly and rapidly the release of macrophage, there's the bad guy, tumor necrosis factor, and attenuate systemic inflammation responses. The physiological mechanism termed the cholinergic anti-inflammatory pathway, and we'll show you what that looks like. I'm going to read one more. The parasympathetic tone is the key for balanced cytokine regulation. So here, this guy we're going to be talking about is Kevin Tracy, who did a lot of work to figure out this pathway called the cholinergic anti-inflammatory pathway. And today, they're talking about some of the pharmaceutical industry is making these muscle stimulators that are surgically implanted into a patient's chest who has autoimmune disease to stimulate the vagal nerve. We're going to do this a little bit less invasive. So in this article, it says inflammation is a local protective response to microbial invasion or injury. It must be fine-tuned and regulated precisely because deficiencies or excess of the inflammatory response cause morbidity and shorten lifespan. The discovery that cholinergic neurons inhibit acute inflammation has qualitatively expanded our understanding of how the nervous system modulates immune responses. The nervous system reflexively regulates the inflammatory response in real time, just as it controls the heart rate and other vital functions. The opportunity now exists to apply this insight to the treatment of inflammation through selective and reversible hardwired neural systems, which we're going to teach you how to do. Here's another one from PubMed. The vagus nerve stimulation attenuates the systemic inflammatory response to endotoxin. When we talk about endotoxin, which we'll talk about again, is that's gram-negative bacteria. And a lot of our patients have leaky gut, and these gram-negative can leak through, and the coat, the lipopolysaccharide coat of that bacteria, when it sheds it, it creates an immune reaction. Our body doesn't recognizes that as a foreign invader, and it creates a lot of havoc, which we'll talk about. So vertebrates achieve internal homeostasis during infection or injury by balancing the activities of pro-inflammatory and anti-inflammatory pathways. Here we go. Endotoxins, those lipopolysaccharides, produced by all gram-negative bacteria, activates macrophages to release cytokines that are potentially lethal. The central nervous system regulates systemic inflammatory responses to endotoxin through humoral mechanisms. Activation of afferent vagus nerve fibers by endotoxin or cytokine stimulates hypothalamic, pituitary, adrenal anti-inflammatory responses. However, comparatively little is known about the role of efferent vagus nerve signaling in modulating inflammation. Here we describe a previous unrecognized parasympathetic anti-inflammatory pathway by which the brain modulates systemic inflammatory responses to endotoxin. So acetylcholine, the principal vagus nerve neurotransmitter, significantly attenuated the release of cytokines, tumor necrosis factors, interleukin 1 beta, interleukin 6, and interleukin 18. So it kind of blocks that, it downregulates that, but not the anti-inflammatory cytokine interleukin 2. So in lipopolysaccharide stimulated human macrophage culture. So when we have those bacteria leaking through, they're going to stimulate all these inflammatory cytokines again that we just talked about. Direct electrical stimulation of the peripheral vagus nerve in vivo during lethal endotoxemia in rats inhibited tumor necrosis factor synthesis in liver, attenuated peak serum tumor necrosis factor amounts, and prevented the development of shock. So normally the animals that they put the endotoxin in would have gone into shock, but they were able to stop that by stimulating electrically the vagus nerve. The reason I mention this is because this is a lab test that I run from Dunwoody Labs. It's an advanced intestinal barrier assessment, and it measures some other parameters beside this, looking at zonulin and histamine and other factors that can influence intestinal barrier permeability, which is leaky gut, right? And so you can actually measure these. This is lipopolysaccharide, the coat of the gram-negative bacteria that creates all that inflammatory havoc, and you can measure how the body is responding to it through LPS-IgA, LPS-IgG, and LPS-IgM. And in this case, this person is really having quite an inflammatory response to that, abnormally high, and borderline high. So you can look at that. So that takes us to the history where we're headed with this whole thing. Just hang in there with me, and we'll get to the good stuff. But this started with this Dr. Tracy. He had this patient. She was a little girl. She was 5 years old. And her grandma, by accident, dropped scalding hot water. She must have been probably making pasta or something. I don't know what. The little girl was under her feet. She dropped it and burnt the girl. And this little girl had many months of treatment, and Dr. Tracy was treating her, and then finally she dies. And he wants to understand why the girl died when they did not find an infection, what was going on. Basically, they found it was the overproduction of tumor necrosis alpha, which is a highly inflammatory cytokine. This molecule is involved again in inflammatory bowel disease, rheumatoid arthritis, sepsis, to shock, lupus, most of the autoimmune diseases. And so later on, he was working on producing pharmaceutical drugs to deal with the tumor necrosis factor alpha. There's this one here, CNN1-1493, and he was doing this. He was working with animal models where he would induce stroke, and then they would figure out, see if this medication would block the tumor necrosis factor alpha. This not only turned off tumor necrosis factor alpha in the brain, but for some reason it blocked it in the liver, the lungs, the spleen, and the gut. So they couldn't figure out why that was happening. Why did this drug block? It was designed for the brain, thought it was very specific for the brain, but it blocked tumor necrosis factor in all these other regions of the body. He started to study the neural pathway responsible by cutting different pathways, right? And when cutting the vagus nerve, they did not have the same effect, the blocking effect of blocking the tumor necrosis factor. So he discovered basically it was the vagus nerve. They would induce shock in animal models. They would go into shock sooner if you cut the vagus nerve, but if you electrically stimulate the vagus nerve, you block tumor necrosis factor response, and the animals are protected, and they don't go into shock. Okay, so the next progression, there are drugs. There were drugs out there that block tumor necrosis factor alpha. There's a lot of monoclonal antibodies to tumor necrosis factor, but there's a lot of side effects to that in these autoimmune conditions. But they discovered that most tumor necrosis factor is made in the spleen, and the vagus nerve traveled from the brain to the spleen. Next question was, how does the vagus nerve stimulate the macrophages? So I'm jumping ahead here, but the neural signal enters the spleen, releases norepinephrine, communicates with T cells, and the T cells make acetylcholine that turns off tumor necrosis factor response. And the T cells are a unique subset called CD4-CHAP. And discovered the specific receptor involved on the macrophage is called the alpha-7 nicotinic receptor. So we're going to be able to stimulate this to reduce these inflammatory responses, is what we're really looking at, and bringing up the parasympathetic nervous system. So this is something I found quite a while back when this research was just beginning. And so even though it may not be loud enough, you can read the captions, because I want you to read this. This is very, very important for what we're going to be doing.
A couple of minutes. I'd just like to give a couple of thoughts about clinical implications of this. First of all, there's an amazing amount of work that's been done. Some here at the NIH, and Julian Thayer and others here have done a lot of activity to look at how does one measure the activity, the physiological activity of the vagus nerve in humans. And the answer is you can do that a number of ways. A very accessible way is to collect EKG data and look at the distance between individual heartbeats. Each time the vagus nerve fires, it transiently prolongs the time to the next heartbeat. And this measure of instantaneous heart rate is actually an indicator of vagus nerve activity. And one can do Fourier transformations on time domain data to basically derive equations that show the activity of the vagus nerve in healthy volunteers or in people with a number of or in disease subjects. And every time this has been looked at so far, patients with autoimmune diseases or inflammatory diseases or traumatic diseases have decreased vagus nerve activity. And historically, this was believed to be the fact that, or it was presumed that the inflammatory mediators were somehow downregulating the vagus nerve. But the hypothesis we're really developing now is that decreased activity of the vagus nerve allows the overexpression of cytokines, which then contribute to or mediate the disease. We've begun to do some work on this at our center with Richard Goldstein and Annette Bushfeld. Richard was a fellow in the lab and is now an independent investigator working in the GCRC, and Annette Bushfeld was a visiting scholar from the Karolinska. And what they did is enroll patients into a study, a rheumatoid arthritis study, and first ask the question of how much vagus nerve activity do rheumatoid arthritis patients have? And the answer is it's highly significantly decreased. In fact, if you look at the distribution of the normal population, there's only 3 people that are in the same range as the arthritis patients. And the question we've really talked about at lab meetings is there something wrong with these 3 people, and are they at risk from some inflammatory disease? On the other hand, the question is, can we increase the vagus nerve activity of these patients to the normal range and improve the clinical outcome? And in fact, that's what we hope to be able to do in the next couple of years, to do that experiment. In the meantime, of course, the arthritis patients have significantly higher levels of HMGB1 as compared with the controls. One could say, well, perhaps the high level of HMGB1 is occurring because across this disease spectrum, and it's actually causing the downregulation of vagus nerve activity. We don't have enough patients to answer that definitively, but we've begun to look at HMG levels from mild, moderate to severe disease, and the hypothesis would be, of course, that patients with the most severe disease would have the lowest level of vagus nerve activity and the highest level of HMGB1, and in fact, that's not the case. Patients with even very mild disease with low levels of HMG have extremely low levels of vagus nerve activity, suggesting that the loss of vagus nerve activity is upstream of the dysregulated cytokine production. And finally, as I was preparing the slides for this talk just a few days ago, I got a Google alert informing me that the Pittsburgh group had just published a paper showing that paced breathing in normal human volunteers, human subjects, as a mechanism of increasing vagus nerve activity, measured by these parameters of heart rate variability I referred to, that paced breathing significantly correlated the level of vagus nerve activity to the stimulated levels of IL-1, IL-6, TNF, and IL-10 in subjects when their whole blood was removed ex vivo and stimulated with endotoxin ex vivo, suggesting that perhaps in this starting experiment in healthy volunteers, that simply increasing vagus nerve activity transiently through paced breathing exercises can impact in a statistically significant way the output of cytokines from whole blood removed from those patients after vagus nerve stimulation and stimulated ex vivo. Very, 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 potentially very important and very exciting, and potentially very useful in the design of clinical trials going forward to stimulate the vagus nerve and develop secondary clinical endpoints. So in conclusion,
So when I saw this, I got real excited. I saw this many years ago. This is a lecture at the NIH, and as you look at that, they're using heart rate variability, which we all are. They're using he talked about the breathing program to stimulate vagal tone, reducing inflammation, and we're going to be doing that. And that's just some of the things that we'll be covering today. But it's just great to see that what we're doing is in the mainstream literature. So here's one more. This is just going to show you the mechanism of what's happening here.
Electricity in the device. And again, histological protection against joint damage with preservation of the cartilage and less bony destruction, as you see here, attenuated significantly here. So at this point, we understood the mechanism. The signals travel to the spleen where they converge on neurons that release the first neurotransmitter, norepinephrine. That regulates T cells that release the second neurotransmitter, acetylcholine. The acetylcholine travels to the macrophages that express alpha-7, and the interaction of acetylcholine with alpha-7 turns off the production of TNF, IL-1, IL-6, IL-8, and HMGB1, And it actually turns on the production of IL-10 and some other anti-inflammatory mediators. So now we were ready to do a clinical trial.
So just to get a quick look at that, so the key is the acetylcholine and how it interacts with specific receptors, specifically the alpha-7 nicotinic acetylcholine receptor, okay? And this is just blown up for you to see slowly. Here's the vagus nerve going down the splenic portion here to the spleen. This is blown up, and you can see that it's going to release norepinephrine, and it's going to go to connect to the receptor here on the T cell. The T cell is going to release acetylcholine to those very specific alpha-7 nicotinic acetylcholine receptors and tone down that inflammatory response. So again, activation of the vagus nerve increases the acetylcholine production in white blood cells, which reduces inflammation caused by excess cytokine production in the immune system. So vagus nerve activity, what we're talking about here is decreased HRV, especially vagus nerve activity, is strongly correlated with morbidity and mortality in the following cardiac surgery, myocardial infarction, progression or disease severity in autoimmune conditions, including rheumatoid arthritis, inflammatory bowel disease, and systemic lupus. So now we're getting into some really interesting area here. So I found this article. It says transcutaneous auricular, that's the ear, vagus nerve stimulation protects endotoxic rat from lipopolysaccharide-induced inflammation. So whenever they want to create inflammation and these kind of reactions in the body, they give the rats the lipopolysaccharide, the gram-negative bacteria coat. And here it is. So here's the gram-negative bacteria. Here's the coat, and what they're going to do is give these mice, these rats, this endotoxin, and it's going to produce all these inflammatory cytokines here, resulting in inflammation. And then they're going to stimulate these mice using electrical stimulation and electrical stimulation of the vagal point to stimulate the cholinergic anti-inflammatory pathway. So there's several places you can stimulate the vagus nerve, and we're going to talk about a few. This particular one has to do with the auricular vagus nerve stimulation, which is really easy to get to on the ear. And this is another one where they're going to stimulate stomach 36 on the body, which is about right there on this animal here. And here it is here. So they measured the concentration of pro-inflammatory cytokines and tissue levels of NF-kappa B65 that were detected in endotoxemia affected anesthetized rats. So they had 3 different ways they were going to do this stimulation to affect the vagus nerve. One, they stimulated the efferent vagus nerve here. One, they did it on the ear. And one, they stimulated that stomach 36 point, that acupuncture point right there. And they all activate the cholinergic anti-inflammatory pathway we've been talking about, inhibition of NF-kappa B activity, and inhibition of cytokine levels that cause all that inflammation. So here's the outcome of all this stuff. They attenuated the release of cytokines significantly and improved survival in lethal endotoxemia or sepsis models. Vagal nerve stimulation using the transauricular or TAVNS, that's just stimulating the vagus point in the ear, suppressed the pro-inflammatory cytokine levels such as tumor necrosis alpha and NF-kappa B65 expression of lung tissue. When they did the stomach 36, it also decreased LPS-induced high tumor necrosis factor alpha level with NF-kappa B65 signal. So the present paper demonstrated that transcutaneous vagus nerve stimulation could be utilized to suppress LPS-induced inflammatory response via alpha-7 nicotinic acetylcholine receptor-mediated cholinergic anti-inflammatory pathway. It's kind of a mouthful. Just quickly, this is from Dr. Agarwal, who was MD researcher at MD Anderson. He's the one who did all the work on NF-kappa B, and you can see how it's tied in to all these different pathologies that we see in the body. And then he talked a lot about specific herbs to attenuate this and to affect this NF-kappa B. One of them being curcumin. A lot of work on curcumin, which is a good idea to give our patients curcumin. So NF-kappa B activation is a major mediator of inflammation in most diseases, and inhibition of NF-kappa B activation can suppress inflammation. So, we want to stimulate that anti-inflammatory pathway. So auricular acupuncture and Shen Min in 0.0 points induce parasympathetic activation. We're going to talk about that and show you how to stimulate that. So in this paper, they're talking about why they used the ear, and they said they used the ear because auricular acupuncture has been applied in order to relieve post-operative pain and improve neural rehabilitation and insomnia. So in this study, these are people who had half of their colon removed because of colon cancer. Okay, and it was shown that after agitated patients received auricular acupuncture at tranquilizing points, that's the 0 point that we're talking about here, they did not show post-operative problematic behaviors such as agitation. Some studies have suggested that these techniques would modulate the reticular formation and the autonomic nervous system, thereby creating the results above. And for those who just want to know more about the reticular formation is part of the brain that is involved in actions such as awakening and sleep cycle and filtering incoming stimuli to discriminate irrelevant background stimuli. It is essential for governing some of the basic functions of higher organisms and is one of the phylogenetically oldest portions of the brain. So it's going to stimulate the vagus nerve, reticular formation. And here's the main abstract. Here's what I really want you to get out of this. The goal was to affect the autonomic nervous system using specific auricular points that could normalize the body's dysfunction, creating pain relief, relaxation, etc. So Shen Min and 0.0 were used on the post-operative patients who had undergone a hemicolectomy for colon cancer. Treatment was performed before and after surgery, and they were monitored on heart rate variability. The conclusion was that auricular acupuncture kept the LF to HF ratio at lower levels and HF at higher levels during the post-operative period in the patients who had undergone hemicolectomy. So these are the points that we're going to be using, and I'll show you the Shen Min and 0 point, really easy to find. One's right here, if I can point to it. Yeah, right there, easy to find. And here's the 0 point. That's a point that I'm going to suggest to use on all your patients. It was hypothesized that auricular acupuncture at the Shen Min and 0 point would tranquilize the minds of patients during the post-operative period, thereby changing the autonomic nervous system activity. The data indicate that occlusive press needles at the Shen Min and 0 points on both auricles increase parasympathetic nervous system activity. Now, so what I do is I'm going to stimulate, and I'll show you how I stimulate those points with a little device, and also then I can put these little stickers, these little press needles, or these little little dots that go on there so the patient can stimulate them through the day. So here's another point they talked about too, which is the heart points and improving HRV total. So they said, manual ear acupuncture at the heart auricular point induced a significant decrease in heart rate and a significant increase in heart rate variability total. So that's another point that I think we could get a lot of traction out of. Here's another one. Auricular acupuncture may suppress epileptic seizures via activating the parasympathetic nervous system, a hypothesis based on innovative methods. So auricular acupuncture is a diagnostic and treatment system based on normalizing the body's dysfunction. An increasing number of studies have demonstrated that auricular acupuncture has a significant effect on inducing parasympathetic tone. Epilepsy is a neurological disorder consisting of recurrent seizures resulting from excessive, uncontrolled electrical activity in the brain. Autonomic imbalance demonstrating an increased sympathetic activity and a reduced parasympathetic activation is involved in the development and progress of epileptic seizures. Activation of the parasympathetic nervous system, such as vagus nerve stimulation, has been used for the treatment of intractable epilepsy. Here we propose that auricular acupuncture may suppress epileptic seizure via activating the parasympathetic nervous system. So basically, to cut through the chase here, here's the ear. They stimulate the points that we were talking about here, the vagus nerve and probably Shenmin 0 point to stimulate the cranial nerves innervating the external ear, because we'll talk about that, increasing parasympathetic tone. That activates something called the nucleus tractus solitarius. And that works by suppressing structures related to pathogenesis of epilepsy by kind of straightening out that desynchronization of an EEG of epilepsy. So you got this desynchronization of the electrical activity of the brain, and it kind of straightens that out a little bit to treat epilepsy. And also, we're also activating through the ear here the cholinergic anti-inflammatory pathway and controlling inflammation, treating the epilepsy. That's what they're talking about here. So we're going to use something called the Stem Plus Pro, which has a point finder and a 3D auricular therapy program, so you can see exactly where those points are, and you can even punch in specific things that you want to look at, and it will bring that diagram up for you to investigate, so you know where to stimulate. So here it is. Shenmin is the point that is the most popular in auricular 3D protocols. In fact, if you are having a hard time finding active treatment points, treat Shenmin first, and then the points that need treatment will become active. So the points, when you're measuring with this device, you're measuring, you'll hear a sound change when you're moving it across the surface of the ear, and you'll get a higher pitch, and that's in the areas of least resistance. And those are also active points that need to be treated. And sometimes they're a little silent until you treat Shenmin. Shenmin, also known as divine gate, is so powerful that it treats almost everything: stress, anxiety, depression, inflammatory diseases, etc. The other point that we'll treat is the sympathetic autonomic point. So, as we know, most of our patients, too many of our patients, choose to live in a constant sympathetic nervous system state. The sympathetic nervous system was designed to jumpstart our bodies into fight or flight mode for survival purposes. Basically, our digestive and organ function shut down so that we can save ourselves during emergency situations. And again, they're talking about the parasympathetic mode. On the other hand, is where we should be most of the time. This is where our body regenerates and heals, and we all know that. And when someone comes in for acupuncture, it is our responsibility to help him or her to move back into parasympathetic function. The sympathetic autonomic point will do exactly that. So it balances. It says sympathetic autonomic point, but it balances the autonomic nervous system. So we want to use that. And, I'm not an acupuncturist, but it's so simple with this little device to stimulate these points to get big changes, which I'm going to show you. So here's somebody who's a sympathetic dominant. That's our new software, which hopefully you guys are using at this point. And those are people that we want to use that point with, right? So auricular therapy versus acupuncture. Auricular therapy is a separate entity to acupuncture, does not rely on meridians. They say no meridians enter the ear. I'm not really positive on that. Acupuncture points do not move, can be found whether channel is active or not. Auricular points only appear when there is some physical or functional disorder in the part of the body represented by that region of the ear. Again, we'll hear that sound pitch going up. So it will sound like this. If I turn it on here, I don't know if you can hear that. It's probably hard to hear. The sound will go up and you'll be able to hear it. Okay. We're going to use a StemPro Plus stimulator, and it detects the stimulation and detects and stimulates active reflex points on the external ear. Let me turn this off. It's non-invasive electronic technology. The goal is to improve brain and body function. One of the premier researchers was Dr. Paul Noget, and he developed a whole diagnostic system using the ear. And Dr. Paul Noget discovered auricular therapy in 1951, really. And since then, several countries, and in particular China, have adapted this method. And previously, ear points were a scattered array of different points for different conditions. Now, somatic inverted fetus pattern of points, which correspond to the pattern of the actual physical body. Here it is. So, with this little device, you can follow this and actually treat different areas of the body very easily. He also has a much more sophisticated system of auricular therapy where he looked at the embryological tissue of the ear, mesoderm, ectoderm, endoderm, and he felt that if there was a chronic condition, acute condition, it would be in a certain part of the ear where that would be the active points would show up, and then as you go more chronic, it would go deeper into the system, and he has a whole way of analysis for this and when to treat the different points. And also he used to use a particular pulse he developed called the VAS that was really a reflection where you'd measure the pulse, kind of like Chinese medicine, but you were using it to monitor the autonomic nervous system, and you would place different substances that he had, colors and different therapies, different pathogens that he would place by the ear and measure the VAS to use the ear, kind of like we do muscle testing to see if there was a change in the nervous system. So we kind of could diagnose and figure out what to treat, and treated these patients through the ear. Quite involved. So auricular points only appear when there's some physical or functional disorder in the part of the body represented by that region of the ear. We kind of said that. In auricular therapy, the anatomical arrangement of the ear points based on the inverted fetus map of the body matches that organ and affects its function. Auricular therapy does not require needles, and instead of meridians, uses nerve connections. So the ear to the brain connection is the shortest and most direct of any of the neurological microsystems. So we're affecting the nervous system, basically. Auricular therapy points expressed by 4 cranial nerves. There's the facial third division of the trigeminal, glossopharyngeal, and vagus, and the third cervical ganglia, second, third, and fourth. So it's direct connection to the nervous system there. The points you are utilizing on the ear are assessing those nerves. When using the StemPro, you will be measuring the skin conductivity and resistance to determine which points to activate. So here it is. Let me show you this case study using StemPro Plus on auricular points. So here's a baseline on the HeartQuest above, and we use Shen Min 0-point sympathetic vagus point in the heart. You probably, I don't know if you needed to use all those points, but I was just curious because all those particular points have a direct effect on the autonomic nervous system and the parasympathetic nervous system. So you can see that this is 1024, this is 1040. So right after treatment, it made some changes. You can see that right there. If you go to the next screen here, it dropped the stress index significantly. It increased parasympathetic, which it's supposed to do. It dropped the autonomic nervous system from 200 to 191. So, I mean, that's pretty quick. It changed the neurohormonal regulation immediately from 50 and brought it up a little bit more. Improved the HPA axis a little bit. Improved the metabolic rate index, 124 to 151. That was an improvement. Definitely had an effect on the total power of the brain from 50, brought it up to 57 into range. Seemed to really bring up the serotonin and pretty much brought everything's a little bit more in balance, including epi. It actually had a tremendous effect on the brain and really shot up that alpha waves, calming more parasympathetic really. Improved the total organization of the system, the biorhythms, the biorhythm coherence, brought that up. Biological age, this person's 61, they're more like they're 52 in the base. Now they're more like they're 48. That's a pretty good deal. Brought up the total power from 51 to 59. Excuse me, not power, but the peak performance. And brought the sodium, which is back into balance a little bit. Brought the magnesium more in balance, calcium, and it brought the DHEA back into the center. Interesting. Estradiol, and just some interesting things here. This is what I found real interesting. Very, very interesting. Okay. Look at all the normal after that. It almost balanced all the meridians. The only one it didn't balance, which we could go back in, and maybe if we use the auricular therapy to stimulate the liver and support that liver a little bit, we can get that taken care of as well. The heart is still a little bit excess, but it's pretty much amazingly, I'm saying this because this doesn't usually happen like this, very, very effective in balancing those meridians. And you can see here, if you look at the deficiency, they're more yang and deficient. Now that's brought it right back into the center just by stimulating those points. Okay, much more balanced look here. And when we look at the energetics of the body, and we look all the way down here, we can see that the pre and post, we can see that it improved all the energetic plexus, every one of them. Except for maybe this one right here. Maybe this one needs a little bit more work here. Okay, but most all of them have gone up, which is okay because we can go back in and actually treat this particular area. If you're using this particular technology, you can also use it, like I said, specifically to balance individual meridians. So in this case, the gallbladder and the liver and the kidney and the large intestine need to be tonified or strengthened because there's not much power here to begin with. So we always want to strengthen and tonify when there's a lot of, because the range should be between 1500 to 3500. So you want to strengthen these meridians because the total power is low. The balance range, again, is 1500 to 3500. So just look at the deficient meridians and get a good idea. They give you a good idea of what systems you need to support, like we talked about. So you can use it that way as well. So when we want to increase that vagal nerve function, in the literature, there's things on PMF. I've played with that. It really depends on a lot of things. It's not going to help. Some people it's going to help and some people it's not. I think it depends on that individual's unique constitution. It has to do with if they have enough minerals in their system and they're hydrated. And there's a lot of other factors that we're talking about. Meditation can increase vagal tone. One of the big ones that we're going to use with the auricular therapy is the HeartQuest BFB program, the individualized breathing program that Dr. Tracy talked about when he was speaking at the NIH. In this lecture, we're not going to go into it, but there's specific probiotics that can help maybe the vagal nerve function. Massage can help. Fasting, intermittent fasting. Singing and humming because it stimulates the glossopharyngeal nerve. Laughter. And sticking to the research that we have seen, auricular therapy, stimulating the vagal point and the stomach 36 maybe, and some of the 0 point and Shen Min and some of these other points we were talking about. What are the effects of taking omega-3 and HRV? Because we're trying to improve the heart rate variability, right? So this is a really interesting study. In the study published in the February 25, 2008 issue of Circulation, Mazzafaran and colleagues write that the positive associations with the various HRV parameters suggest that fish and fish oil consumption influence heart rate variability by augmenting, guess what, vagal tone, modulating adrenergic mediated baroreceptor activity, and improving sinoatrial node function as reflected by reductions in erratic sinus firing. As investigators point out in their paper, the reduction of serious cardiac arrhythmias is one of the possible mechanisms by which omega-3 fatty acids exert a cardioprotective effect. Although the mechanism underlying the relationship is not well established, declines in HRV are an independent risk factor for cardiac arrhythmias, sudden death, and MI, right? Mazzafaran and colleagues, but by increasing HRV, the beat-to-beat variability mediated by the autonomic nervous system, omega-3 fatty acids could reduce the risk of these serious cardiac arrhythmias, particularly during myocardial ischemia and infarction. Understanding the effects of fish or fish oil on HRV is important, the group writes, to determine the specific mechanisms of protection and to provide additional evidence of clinical benefit. To do this, the investigators evaluated the association of usual dietary fish and omega-3 fatty acid consumption during the prior year and ECG-derived and 24-hour Holter monitoring HRV of 4,465 participants in the cardiovascular health study. That's a lot of folks. After adjusting for demographic variables, clinical risk factors, lifestyle, and diet, tuna, other fish intake was associated with greater HRV as measured by various time domain indices. Indices reflecting short-term, daytime, and nighttime parasympathetic HRV. Tuna, other fish intake was also associated with frequency domain indices, indicating lower normalized low frequency power, higher normalized high frequency, that's your parasympathetic, and lower LF-HF ratio. Consumption of fish was also associated with a lower Poincare ratio, a measure reflective of less erratic sinoatrial firing. There are two consistent groups of indices, said Mazzafaran. The first were indices that were related to greater activity of the vagus nerve, the parasympathetic nervous system. The other is reduced erratic heart rate variability. Those were the two most strongly affected indices. Both of these are predictive of risk. So the effect of fish or fish oil on these indices supports the benefit of fish or fish oil on the risk of sudden death. Mazzafaran said that the effect of fish oil on the vagus nerve supports previous studies conducted by this group showing that fish oil reduces resting heart rate. The effect of fish oil on erratic heart rate variability is particularly interesting, he added, because it shows that fish oil has a direct effect on the heart, an effect most likely related to actual sinus node cells that are firing. In an analysis looking at the clinical significance of the findings, the investigators showed that even for the small differences in HRV associated with fish consumption, these differences predicted between 1% and 8% lower risk for cardiac death and could explain a significant component of the 35% decrease in cardiac death as seen with fish intake, said Mazafarian. Excuse me. These findings were similar for estimations of dietary consumption of omega-3 fatty acids. Suggestions that the findings may relate to the omega-3 fatty acids in these fish meals, the authors write, fried fish intake was not associated with any of the HRV measures. So, I'm just looking for different ways that we can use natural therapies to improve our patient's outcome and get better HRV results. So the kind of fish oil, there's more research here. I'm going to skip through that. Here it is. So what fish oil should we use? Well, here it is. All fat-soluble, whether fish oil in triglyceride form, excuse me, losing the voice here, or in this krill oil form, or olive oil, have to be broken down by bile and lipase to be converted to the only absorbable form, monoglyceride, before it can be absorbed by the mucosal membrane. So I don't know about you, but I have a lot of patients who have trouble breaking down their fats. And I do some genetic testing, and I find a lot of folks actually have some genetic SNPs and mutations that don't allow them to break down their fats. And that's a pretty important thing to get into the cell to produce energy or for their cell membranes. So you want a product that is already broken down into the monoglyceride form. This will bypass the problem with relying on the patient's own digestive system to break down the fats in the fish oil and assimilate them. Excuse me. So with a 3.14 times the absorption of triglyceride or ethyl ester fish oil, one soft gel provides the equivalent of almost 3 grams of EPA DHA. So it's real powerful. You get it in there, and you can test it out on the Omega Quant test if you want to check it. I like to use the RJL bioimpedance looking at phase angle, which gives me an idea of how healthy their cell membranes are. Simple bioimpedance testing. So basically, we want to use our breathing program. We want to use the sympathetic nervous system autonomic point to balance our autonomic nervous system. Oops, the wrong way. We want to use the vagus nerve point because that's going to help us with that cholinergic anti-inflammatory pathway. We want to use, we can use our chart of the meridians here to look and see what's deficient and what we want to tonify. Within the software, they have all the TCM points that we want to use when we look at our meridian pattern on the heart rate variability to see what areas we want to stimulate or tonify. This is new, and that's in your heart rate variability system right now. You click on this, and you can also look at the meridians, and you can see what homeopathic remedies may help that particular meridian or what cell salts would be appropriate. Built in, and I don't know how many of you know this, but we have this built in here for those that do AK, with muscles to test to check out those particular meridians and how to stimulate them using the neurovascular point. We have the essential oils in here to balance the vata doshas. So we have lots of different new treatment modalities, and some of them old that you guys can utilize. I want you to go ahead and use this because I think this is really powerful. And then you can send the patient home with the little seeds on their ear. You can order this on our website. You go to our website, www.hrvhq.com, click on order at the top of the page. This will come up here, And you just click here to order the Stim Plus Pro with Auricular 3D auricular therapy software, and that's what it costs, but it's well worth it. You got the software built into your computer. You have another way of stimulating specific points to increase vagal tone, parasympathetic activity. I want to thank you for listening today, and we're going to continue doing this. We're going to go on to the next stage and go over some test cases with you. I'm going to have you start sending in some cases to Dr. Karamoff, and we're going to start doing some review of some of the cases. And I look forward to seeing you at our next webinar.